Hello, colleagues and fellow leaders. I'm coming to you today to talk about a very important topic that affects us all, no matter where we live in the world today. It's about health and how our health is affecting and interacting with employers and the communities we live in. First, just a moment of background about myself. I'm Terry Williams, Executive Vice President and Chief Strategy Officer at Wake Forest Baptist Health in North Carolina in the United States. I've worked with over 200 health systems in the last several years, as well as being involved with the National Transformation Program in Jamaica some years ago. At Wake Forest Baptist Health, we are an academic medical center for a large region in North Carolina and serve patients from over 48 states and several countries around the world. I'm hoping that a few of the thoughts today might be helpful to you on your journey of providing health and a vibrant environment, even amidst the COVID crisis that we all are faced with today. Now, to talk about the agenda for our time today, I have a handful of topics. First, we'll talk about some of the challenges that employers and communities are facing today and the difficulty it is to navigate as the COVID crisis has had such a great effect on businesses and schools and our communities. We'll talk about an effective communication and community mobilization effort that managed to connect a lot of different entities in a highly effective way and touch a lot of lives in a short period of time. And I'll use that as a case study in just a moment, including some of the lessons learned. We'll talk about a second pandemic that's growing in this world and follows closely on the heels of the COVID pandemic, and that is a pandemic of mental health challenges. This is something that's often stereotyped, and we want to make sure that it's able to be discussed openly, because in that way we can come up with solutions to help with the challenges. Finally, we'll talk about some lessons learned and some key messages from today's talk together. Now, on the screen, you should see a curve that demonstrates some of the challenges that we've each gone through as we were first exposed to the COVID crisis. First, as you can see in the lower left, we would have been faced with feelings of shock and needing to figure out how to adapt and respond in such a difficult situation. Today, we're moving to the next phase in most cases where we're beginning to think about what processes need to change. How do we need to work together differently in our communities? And how do we need to activate businesses to do things differently so that we can begin to invite consumers, travelers, and various types of individuals back into our workplaces in a safe way and the right timing. So while we have several more months to go on this journey, and in fact it could be longer, we want to talk about some proven ways for navigating this curve. First, I'll share some insights that are happening with companies all over the region in which I live, and perhaps some of them are useful to you. I'll only highlight a few. You can see more of them listed on the screen. First, cleaning schedules are being increased to happen more frequently, and actually we would now advocate that they happen in front of consumers. In many workplaces, cleaning happens behind the scenes, but by cleaning in a more proximal area to where people are, they can have higher confidence in your cleaning methods. Also, we'll highlight that employees and customers wearing face masks in their offices or workplaces is increasingly common, and in fact, while these plans are initially rolled out, there may be some pushback. We are finding that as it becomes more of a standard, people actually feel more comfortable in some of those shopping places or workplaces when they know protections are being put in place. Limited sharing of certain types of supplies, headsets, and even desks, telephones, etc. prevent that kind of sharing. You'll also see that access points are being altered so that people are using different entrances, and days are being staggered so that individuals come in on different days instead of coming every day. And finally, you will see capital upgrades being made that can help with filtration or help perhaps with other types of auto door opening or other things so that there's less physical contact in some devices. You'll also see physical barriers being erected in some retail spaces as well as in manufacturing facilities to create more distance between the workers as they're working. So while these are all important and they're things that we should be working on as employers, I'm going to shift topics now to talk a little more broadly about some lessons and concepts that you can hopefully find helpful. First of all, the fact that social isolation, hand washing, and masking are proving to be the most practical actions that each of us can take to reduce the spread of the virus. Number two, there's a prediction now of a surge in cases in some parts of the world, including in the United States, beginning this fall. This surge may be more severe than anything we've experienced to date, and so as such, we should not let our guard down. Number three, there is a recent increase in cases occurring in people in their 20s and 30s. We hypothesize that's because they have taken the COVID-19 a little less seriously, and as spring break or other types of graduation activities may have occurred, they went into social settings with less protection and social isolation, and that started to create a surge. And then finally, there's now evidence in the US at least that states that were less stringent in how they use masking in the community and in the workplace are now seeing increases in cases as they reopen. So we're seeing a direct relationship between those kinds of guidelines and what actually follows. Next, you can see on the screen a summary of the types of data that's being collected to share where the volume of cases is most acute. I will say that even when you look at Jamaica and the 55 or so cases that are shown as active, that almost certainly all of these numbers are understated because they can only register when you actually do testing prolifically. And in most parts of the world, or in many parts in this hemisphere, testing is still done at a fraction of the time that it might like to be done. Looking at the next graph, you can see, though, a couple of trends that are particularly important, and that is that both North America and Central and South America are the highest in the world in terms of new confirmed cases per million lives. They also are the highest in terms of new deaths per million lives. So again, the data shows that it's not a good time to let our guard down, and in fact to redouble our efforts on how to slow COVID wherever we may be. Now I'll shift and want to talk to you about the case study that I was referring to a minute ago that has some good generalized lessons that can be applied in any community. This particular case example took place in Winston-Salem, North Carolina. A group of businesses, government leaders, private sector leaders, and churches came together with a vision that said we need to enable masks, food, and transportation to be more prolifically available across the community. Businesses and others actually helped support this economically and bought masks, as you can see here. For over 75,000 free masks were distributed in the community for those that had particular need and could not afford them, and as well as seniors that were most likely to be negatively affected by COVID. All of this occurred within a 2-week period with an amazing set of collaboration. Over 189 organizations worked together to distribute masks, and now food distribution continues in this same network. What are some of the generalized lessons that apply for adoption and spread at scale across a large geography, which would be the concept we're talking about here, is how do you drive change and get it to stick in larger and larger volumes. Number one, this initiative focused on relationships first. People worked together. They were not concerned about who get the credit. They were focused on progress and not perfection, and that they came together focused on the end goal of getting the masks distributed in the ways that were most effective. They divided up the addresses of the city and were very organized in how they distributed. Another key factor was that both healthcare leadership and governmental leadership publicly expressed their support of the initiative so that this could move forward effectively. So in the end, over 155 employers and nonprofits and churches all came together to distribute these 390,000 masks in a couple of very short weeks. Now I would like to move to the next topic, which is about the mental health pandemic that is following close on the heels of the COVID-19 pandemic. As you can see on the curve that's on the screen now, that a series of steps and phases occur in concert with the COVID-19 timeline. As you move forward and get to a time of reaction and adapting where trauma, depression, anxiety, and perhaps substance abuse are more likely, we need to have some offsetting activities to try to help and prevent those issues from becoming so acute. We've had data in the United States that says for every 1% increase in COVID cases, we'll have a 2 to 3% increase in new cases of mental health. Given that the latest data shows that over 25% of people will have a mental health challenge at sometime in their life, we should take this seriously and look at how to wrap services or a loving or conversational ear around that person so they can navigate the challenge, because a lifetime challenge is not have to be the case in many of these situations. So in the case of an example that I'd like to highlight, how do we promote recovery when mental health is an increasing challenge? I want to highlight a few of the pictures that are on the screen now. So in the upper right-hand corner, these are actually individuals at my workplace and the health system that I work in that created a dance of them wearing masks and sharing some fun of doing something that we normally might not think of fun together, but they said, we're going to make the best of it, and we're going to share that kind of joy in making the best with it with others in the organization. We have over 20,000 people in our organization, and so we pushed this video out across the organization along with a number of other pictures to help people begin to accept masks as the new standard. We have also increased the amount of both telephone and video visits to not just typical patients, but our own employees. That's something we can do to reduce the stress that people feel, the stress that can come from working in a different way, working in a different set of habits, or even different days of the week. Grief is also a part of this pandemic. Many people now know somebody that was quite ill or maybe even died. And so being able to have a caring ear or a trained ear that can talk to them or listen is very important to help people navigate this time. And then finally, having an ability to reframe the crisis, give meaning in it, and to help people see how they can contribute to the lives of others is very important to navigate a mental health crisis like this. When people become hopeless, it's because they don't see a path for things to get better. And by coming together, we can help demonstrate paths on how things can get better. Now, going to the next page, slide 13, I want to highlight another challenge in the healthcare space that can be aided by not only healthcare workers, but employers and communities calling attention to it. And that is the fact that fewer childhood vaccines have been given during the COVID-19 pandemic. As people become concerned and scared, perhaps about being in an environment where they think they might have COVID, they may not take their child to get a vaccine. So some of the things that we've done to offset that is to change the clinic hours so that the early hours in the day we might call coming for well baby, well child, or quote clean visits. So these would be people that call ahead and have identified that they do not have a respiratory or other type of potentially contagious illness. And then we have the more challenging or the contagious kinds of ailments come in later in the day. That's one methodology. Another is to concentrate cases of the respiratory cases into specific respiratory clinics. Here, we have been doing most of those outside under a tent, and so that people know when they go inside the clinic that those kinds of cases will not be there. And so again, you can handle it by different set of hours or by concentrating the cases that might be COVID in nature because of their symptoms into specific locations. Another thing I'd like to highlight is a case example of what it's been like to stop COVID once it begins to penetrate a healthcare organization like a nursing home, which is where we've seen some of the most deaths in this country. And that is when a couple of cases are identified in one of these nursing type facilities, immediately all staff and all patients are tested so that you can find out exactly who does and does not have the illness. Those that do have the illness are quarantined, either at home if they are staff or in a certain part of the facility if they are patients. Then you retest again in a couple of weeks, and soon you can narrow down and prevent the spread. So this is a proven methodology. It's not always available if you don't have adequate testing, but certainly several of these steps can be done in an intentional way. Next, I'd like to talk about some tips to build resilience in our workforce and communities. I will only highlight 2 or 3 of these and let you look at the others at your leisure. First of all, it's important to encourage people to make connections. So I know in my organization, we encourage people to talk in new settings and sometimes with specific questions that we want them to dialogue, so that they are continuing to have a social aspect to their work. We want to help people accept change and know that it's a part of living. And even though some of our goals that we set this year, we can't fully pursue now. We need to give ourselves a little more leeway. Sometimes we need to take decisive actions, even though there's some difficult decisions to be made, and we need to keep people from living in limbo. For example, in number 5, we need to nurture a positive self-view and maintain a hopeful outlook. Now, a hopeful outlook being maintained is different from acting like nothing is going on. So if we act like nothing is going on, people will not take precautions, and they will, in fact, will find COVID does spread, and it could be quite bad. So we are both realistic and positive as we're leading people to help in them navigate and be more resilient in the face of change and concern. Next, going to the next slide on economic predictions. Many of us have heard economic predictions for what COVID is doing to our economies and what it could do to our economy. Most of us would like to see a U-shaped, or we're concerned about a U-shaped recovery, actually. That's a more pessimistic recovery and says that there will be a long period of economic downturn. Most of us would like a V-shaped recovery, probably, where we have a short period of time that is not that is negative, and then it moves up, or even the Z-shaped recovery, which means we have extra buying or purchasing or economic consumption that follows a downturn as people are sort of catching up. We don't know which of these is going to actually be true, and in fact, the truth of what we experience may vary by country or even part of the country, and so we need to be prepared for all of them. But there are some truisms, no matter which shape of the economic curve, and this is from the Brookings Institute, would be something that we might be facing. Some of those elements that would allow us to exit the riskiest types of COVID status: one, enabling people to shelter in place, very few social kinds of gatherings in public, as well as community masking, which I've talked about. Other things that are important as a part of this would be having on our checklist or 14 days with declining or stable low numbers. As long as we see increasing numbers of cases, then we should not be relaxing the standards. We need to have personal protection advice or personal protection equipment that's being used by particularly healthcare workers and those that are on the front line or in essential industries. We have found in our own healthcare organization that very few cases have had spread using PPE when it was used properly. The spread has occurred when in community settings, and so that's another good reason to use PPE appropriately in these high contact work areas. Finally, having contact tracing when we find a case and using isolation and quarantine are all important parts of the checklist to be able to relax the regulations and the constraints. As I wrap up the last couple of slides here, I want to highlight some of the changes that in employers and in communities that we're experiencing and some of how our roles are changing. So number one, as community leaders or even healthcare leaders, we need to partner differently to help businesses prepare to ramp up business wisely. And that may mean helping them to screen their employees. We have a large infectious disease part of our organization that's actually providing advice. Your public health department could perhaps do this and allow you to make sure you're using good advice as you're talking to employers about what they need to have a healthy and as clean as possible workplace. Second, we need to be prepared for the mental health pandemic and actually make services available and talk about it openly so that people will do so, not stigmatize a mental health challenge as something to be hidden. Number three, we need to help people seek care when it's needed. Delays in seeking care can really be an issue, and we are encouraging our employees to have more accountability in reporting how they feel before they show up for work. And this can either be done by a phone call, a brief questioning as they enter the building, or in some cases, some employers are using an app on a phone that asks specific questions that they enter their responses each morning before they go to work. And so if you have a large number of employers, you could do this in real time. And then we need to understand location and movement of how people are moving around businesses so that if you have an outbreak, you can figure out where they were. And that may be done through sign-in sheets as people move to different parts of the company. They may be asked to stay and not roam quite so widely as normal, or they might use even QR codes that on doors if you're set up to adequately do that. Finally, the new roles as we move forward with and the healthcare and the public health space, we may be asked to use a variety of testing platforms, and I just want to highlight that not all of them have proven to be reliable. Some of the testing platforms have false positives and false negatives, so be careful about just using any test that's being offered, because sometimes having a false positive or negative could be as bad or worse as not having had the test. We also need to be, one of the final things I'll highlight is that the idea of having a certification process for having clean facilities and best practices is an important thing to do as we are potentially working with some employers to establish a certification process. Finally, I'd like to summarize the key messages of what we've talked about today. Number one, social isolation, hand washing, and masking continue to be important to reduce the spread of COVID. Number two, employers have a role to play to change their workplaces and practices, and by being active, they can be positive catalysts in those workplaces. Number three, community collaboration between government and employers is one of the keys. This challenge with the pandemic is much bigger than any single entity can pull off on their own. And just as the case example that I spoke about earlier, unprecedented collaboration is one of the keys to being able to pull off a effective recovery and in the time of great challenge. We talked about being astute to provide services associated with the mental health pandemic. Don't take COVID lightly, and on the other hand, don't overreact in a way that may cause burnout by not giving people a path to have a day off. And so one of the things we have encouraged in our workplace is when people do have a day off, don't use your pager. For example, in our healthcare environment, let them have full coverage so that they can relax and not feel the stress that goes with some of the increased demands. So I hope some of this was useful to you. I know you're going to have breakout sessions in a moment to dig into these topics in greater detail. I hope you come up with some great solutions to some of the challenges that employers and communities are facing. But I do believe as employers, communities, NGOs, governments, and churches come together in new unprecedented ways, we can navigate this crisis together. Be well, and it's good to speak with you. Thank you.